Health Management Information System. There is a station which will take place here in this room, and the other room which will start at 11:30 in the next cafe room on universal health coverage to improve safe delivery and reduce universal mobility in Bangladesh. Dear participants, speakers, guests, those who are interested for this first session on regular system linkage with public clinic and other newspaper linkage, which will be delivered by Mr. Aliasli. And then there is one more session on the collection and medical record. There is no water use that will be delivered by Scott Jama. And the role and scope of management information system in monitoring and evaluation of HPNCP, which will be presented by Mr. Khaled bin Hassan. And there are two more presentations, different from the initiatives of health management. Dr. Mohammad Shurullah for his presentation, please.
Health management of health information system is used and particularly is used in the referral system. In brief, if I tell about the health information system, this is actually a very functioning health information system, is one that ensures the production or generation of information, analysis, dissemination, and use of reliable and timely health information by decision makers, which is very important. And the decision makers are different levels of health system, and this can be used both in regular basis or in sometimes on an emergency basis. Now, in brief, if I say what the purpose of this health management information system, and I will focus on 4 points. One is to assess individual health needs and management of the care services, assess health status, then to make a plan about health services. And once that is being offered, we have to measure the performance and the results. If I see on the other side, and from the bottom up, then I will say that we need to have information being readily available and accessible, and to use this information correctly, being analyzed correctly, and being interpreted correctly. Then management and policy decisions becomes rational. And if it is that, then we have an effective and efficient health services being provided to the people. And that will increase the coverage and quality of health services. And finally, that will improve the health status of all Bangladeshi population. Why this health information needs to be collected? This is because the assess individual health needs and managed care. The primary purpose of establishing a health system and support system, including health management information system, is to provide appropriate health services to an individual. And therefore, the information of that HMIS captures must be adequate to assist health professionals in clinical decision making and in providing public care. That means, and the mission that will help you to take a correct decision. The assessment of population health and of the factors that influence health requires availability and analysis of a diverse range of information from within and outside the health sector, including the following. That is, change and pattern of the demographic profile, change in the determinants of health, change in morbidity and mortality, and change in the use of effectiveness of health promotion, protection, and intervention initiatives. Why there are reasons to collect this health information? This is to plan the health services. And if you look at that, the planning is a key management process that must be supported by reliable, timely, and well-defined information, and it is to be effective. The health management information system should effectively and objectively target health inequalities along with a thorough set of performance indicators that systematically measure service outcomes. And financial and human resource information should be integrated with service activity and clinical and population health care. If we look here, then we see that if we have information, then we can make a situation analysis, options and appraisal. We need to make priority when there is resource poor person like us. We have to set targets, and the targets can be short-term, mid-term, and long-term. And then resource allocation should be prioritized and tracking performance, and that's a factor based on which the system goes on. The reasons for collecting health information, I will just touch upon few things, but to change the policy, and then based on the changing of the policy, there should be change in the health system and program, and also changing the system performance, changing the service situation and behavior, and finally, there is a change in the health status. The internal data sources, as you see here, there are many sources actually. So it should not only count the data that talks about the health management information system. That can be disease surveillance, it's important. Operation research, the findings that should be collected. The vital decision, logistics, finance, physical safety, these are all integral parts. Because if we do not have the information about these components, then it is not a total HIMS. So therefore, if I talk about the components, that human resource, communications and infrastructure, protocols and training, supervision needs to be there should be quality control, analysis and feedback, paper-based data collection, electronic databases and hardware and software. So that is a range of organizational and also technological aspects. The private healthcare record system in Bangladesh, we see that there is primary level, secondary level, and tertiary level. And we know that this is the structure that we have. We have an existing MIS under Ministry of Health and Family Welfare, and that is in the DGHS, that's in the DG Parent Training, and that is National Nutrition Program. Very nicely linked to the Ministry of Health and Family Welfare. But, unfortunately, as I mentioned, there is a missing link between these. And they should have the link in between these three officers, and then perhaps this will be better utilized in our country. In the health information system, the routine data collection or routine HLS, there are some components that I'm not going to mention here right now. Now, in the routine health information system, the strength that we have, that I like to share with you, what are the strengths we have? One is strong leadership at the national level. So, at the national level, including the Prime Minister, Honorable Health Minister, and the Secretary, DGHS, there is a very strong leadership. And also, there is a support from the highest level of policymakers. That is very crucial. We have improved understanding among the policymakers about the importance of information. We have established district health information system 2. There is a state-of-art data storage system at the national level, and that's not only in Dhaka. We know there are other places, because in order to test there is any other or disaster, we have the storage system in other places. And we are in the process of gradual digitalization of health information system at every level, and interest among multiple national and international organizations on routine health information system. So that's the thing. But sorry to say that I also be telling something about a weakness. That the information for many indicators are not available, even though it is possible. Now let us talk about newborn health. Because I am a clinician, newborn health activist, there are some important indicators of newcomers which are still being missing, should be incorporated. Many information correctly collected do not contribute to any indicator. There are too many information. Perhaps we need to see that whether we can look into the matter. There is concern about the quality of the data currently being collected. There is duplication of reports. Some of the data being collected by two levels of healthcare provider, like health assistant, sometimes A are collecting students. Right. And so therefore, there should not be any duplication. Relying on aggregate data, non-existence of individual level of data, and inadequate use of routine data. Different stakeholders in the health information system, we see there are few groups are working here. Now, routine health information, there are indicators, data collection and recording, data transmission, data processing, data analysis, and finally, dissemination and information use. Importance of MIS in the referral system. These are the last two slides that I will share with you. Health information and referral system links people by identifying their needs, linking them to the most appropriate service. So that's very important. People know where to go. The health management information system is an instrument which could be used to improve patient satisfaction, which is very important because we do not sometimes take care of the patient satisfaction with health services like starting candidates for services. And for effective service delivery in emergency and critical care. The referral system is a health population nutrition sector development program we see here. The final thing is that in order to have an effective referral system, from the primary and from home to primary, secondary and tertiary, the linkage should be such that we know each other. It's not that a referral is made and when the patient arrives in the referral center, he is not being taken care of. So there are coordination between facility and community, and also between facility is important. So probably community there should be a link between Upazila Health Complex. Upazila Health comes to district to medical college. It cannot be from Upazila directly to the medical college. That's the problem in our country. And finally, the functional, effective and structured referral system means that identification of types of services to be provided to each level of institutions, development of referral protocol. Without protocol, since we are running out of time, really running out of time. So we have to maintain the very scientific norms of any scientific conference at the time. Please, I humbly request my presenter, speaker, please, you maintain your time. You have got 10 minutes for your presentation, please. And we have the timekeeper before us, and she will show the different stages of time, like when you have left only 5 minutes, she will show you a card, and then when it's closed, and then she will give you the final signal that you will have to finish in next 2 minutes. So please.
To have the opportunity to say something about the referral linkage in our context. It is said, nothing exists until it is measured. So we need this information to measure whether or how far we are providing health care to the people. So the health information system, Dr. Shrivan has already mentioned that it should be an integrated effort to collect, report and use the health-related information. Maternal health indicators are a major image of overall health status of a country. So maternal health information system is very important determinant of expressing health care status. And referral linkage is one important component of maternal health information system. So referral is a process by which a health worker transfers the responsibility of care temporarily or permanently to another health practitioner or social worker or to the community. It may be required for emergency purpose or medical issues, community disability care. So it should always be a bilateral approach. it's not only from the community clinic to the higher level system. It should be from the tertiary level to secondary level as well as to the primary level. Because it is beneficial for the patient so that it will ensure optimal care for any kind of illness to different level of services. And it will help to enhance the trust of the community people towards the health center. When the patient is referred to higher center and he comes back to his community with the follow-up advice and he can avail the services from the community clinic, it will bring a more trustworthy relationship between the healthcare provider in the primary level and the community. Referral also builds a professional relationship between the healthcare workers of different places. So, what is the present status of referral in our country? Although we provide 3 tiers of service delivery, there in the existing system, referral linkage is almost non-existent. People have the tendency to bypass the primary healthcare facilities in favor of secondary and tertiary hospitals. And proper system of quality patient care is poor at the primary level. There are lack of resources which will compel the patient to go to the well-equipped tertiary level hospitals. But because of for minor ailments also, the people are visiting the tertiary centers. It brings about high pressure on the healthcare providers working in the tertiary or secondary level. So, it is also a wastage of time on the part of the people for having long waiting time as well as for the health professionals. And the persons who are actually in need of tertiary care, maybe they are not getting the service in proper time. And it is estimated that the treatment cost of minor ailments may be 10 to 25% higher if we are giving the service at the tertiary level, which can be given at the primary level. There is an experienced referring personnel who will make an unnecessary referral that makes a relationship of untrust. And also, the referring patients, they are not dealt with properly in the tertiary center because they are overburdened with always the patient load. Proper attention to referral plans is not always given. Maybe a referred patient is attended by a junior doctor in the tertiary level, but actually the patient might need a specialist service. And one study from Nigeria, it shows that only 7% of new patients in the tertiary or teaching hospital were referred. And 30% of the referred patients, the biggest count with referral load. Also they were referred, but there is no referral load. So what can we do? The first thing we have to do is to identify the type of services at each level of service delivery. And we have to ensure that that center provides the service which they are intended to provide. The next one is the development of the referral protocol so that the referring mechanism is a standardized one or a uniform one, and it will prevent any unnecessary referral. We have to create awareness among the staff and communities on the referral mechanism and its needs. Identification of suitable transport mechanism to transport the patient in need for referral care. That's very important. Until and unless we can ensure that the patient can go to the referral center in proper time, no use of referral medication. And there should be a referral desk at the referral hospital where a designated person will record the information and guide the patient to the relevant specialist. Bangladesh government has taken more initiatives under a various programs that mobile phone and service. It has been launched in 2009. That can be used for referral services as well. And telemedicine service that can be expanded after the community gains level. At present, there are some district hospital and Ubuntu hospitals under government of medicine. It can be expanded after the community gains level. And people will be in a better position to get a specific service even without traveling to this camp. And the whole health system can be integrated through Wi-Fi network. So I will conclude that reference system is a process which ensures the accessibility to a high level of medical care to the patients from the community, proper functioning of healthcare centers according to the identified norms, provision of more equitable services, and increased genuine health information system. Thanks for patient hearing.
Thank you, madam, for your wonderful presentation. Thank you very much. Now I would like to request Mr. Carl Jammel for his presentation, please.
Okay, thank you very much. My name is Carl Jammel. I'm an emergency physician from Portland, Maine, and it's an honor to be here. Thank you for allowing me to be here to speak. I was actually asked to speak on the topic of electronic health records. I'm going to be using the term EHR for that, electronic health records, and to a brief snapshot, an example of an electronic health record, how it can connect people, patients, their providers, whether it's doctors or nurses, and hospitals, to the clinics, and even to the government. Just a little background about myself. I'm, as I said, an emergency physician in the United States. After medical school, after you receive an MD, you can actually do a residency training in emergency medicine. It takes 3 to 4 years. Then you become board certified and you practice in the emergency department. Emergency departments are a little bit different in the U.S. as they are in Bangladesh, and that we take care of any emergency, whether it's medical, surgical, or traumatic, in our emergency department. So we have a 70-bed emergency department where I work, and we see all comers. So we stabilize the patient, give initial treatment, and then get them to where they need to go. Whether that's to a surgeon, to an internist, to the ICU, or to the discharge shelf. So I mentioned that for 2 reasons. One, as an introduction, and 2, is I recently learned that Bangladesh is already made efforts and has great interest in promoting emergency medicine as a specialty, and so I'm happy to hear that and look forward to supporting that new action. So, all right, I'm on the clock, so let's go. Electronic health records. There's been many advances of information technology over the past 20 years, and multiple different electronic health records have been developed. So I thought it'd be a good idea today, in a short time, to share our electronic health record and how it came to be. So Dr. Trotha shows a similar picture. This is our hospital, Maine Medical Center in Portland, Maine, a 600-bed hospital. And in just a minute, I'll share with you our EHR. So just a brief introduction to what actually an EHR is, because that term can be different depending on who you're talking to and what country you're in. The World Health Organization uses this definition: collection of electronic health information for and about a person across different institutions and sectors. So from a patient perspective, this would be all of the health information from birth to death that has available access to all nurses and doctors that are caring for that person. So this can include just basic demographic data, or this can include past medical history, car reports, problem lists, medications, radiology reports, etc. It can be all-inclusive. Now, from a provider standpoint, or from a system standpoint, electronic health records can actually connect providers to patients and government. It can educate health professionals, managers, and consumers. It can stimulate innovation. For example, you can tie a certain diagnosis to a specific treatment guideline to make sure that all providers are providing the same care for a specific problem.